This morning. I'm so glad you are here um, for this particular uh, session, Guiding Principles to Improve Mandated Reporting. Next slide. If you are in need of, please sign in. We want to record your attendance in our chat section there. Also, if you are in need of a language for Spanish, please choose your globe and choose the language. We have Spanish interpretation available. Next slide, please. Yes. If you need that, it is available for you. So this morning, we have with us Adam Seiden, who is our All for Kids Director of Policy and Advocacy and External Engagement. Adam is at All for Kids, a nonprofit agency helping more than 50,000 children and parents each year from 14 community sites in Los Angeles and Orange counties. In addition to his role at All for Kids, Adam chairs the Legislative Committee for LA County's Interagency Council on Child Abuse and Neglect, was the chief strategist for Think Together's grassroots lobbying campaign, mobilizing parents to speak out for increased after-school opportunities, and has led delegations of activists for the California Alliance of Child and Family Services at their Capital Advocacy Day. He also served on the California Family Resource Association Programs Design Work Group, developing a budget request for family resource centers. Adam is active on the Prevention Committee of the Association of Community Human Service Agencies and sits on the policy subcommittees of the LA County Domestic Violence Council's work group on DV and child maltreatment. Adam is the recipient of the American Society for Public Administration Los Angeles chapter 2024 Winston Crouch Award for Innovation in Government, and in 2023 was selected to join the narrowing legal definition of neglect subcommittee of California's mandated reporting to community supporting task force, where he helped shape the state's efforts to transform the policies and procedures that make up the front door to the child welfare system. So we want to welcome Adam this morning. And Adam, I know you are here and you have your presentation. We look forward to hearing from you this morning. I'm going to turn this over to you right now.
Sounds good. Thank you. And thank you all for being here to kind of hear about mandated reporting, about how there's certainly an effort to try to make some improvements to that. Especially important. Glad we're doing this in April and Child Abuse Prevention Month. Really looking at the reason that we do this work is focusing on children, preventing abuse, nurturing child well-being. So thank you all for being here. I'm going to go ahead and share my slide and get into what it is that we're talking about. So let's do it from beginning. Can everybody see my screen okay?
Yeah, we can see it. We can see it, Adam.
So let's start with kind of what it is that we're talking about, which is kind of setting the stage. I kind of want to make sure people know some key terms and some things that as I'm talking about them, we're all on the same page. And the guiding principles here that we're talking about, these are all for kids guiding principles of kind of why we got into this work. We want to streamline referrals to families in need of support. Relieve the system if there's things in the system that just don't need to be in the system that makes the system not work as well for what it does need to do for those cases that we do need a child welfare system. Reduce the fear of asking for help, and then also reverse trends that are destabilizing often families of color. And so that's kind of like, that's what we're doing this for. I want to start with a few key terms to know. First of all, this idea of mandated reporting to community supporting. And we actually have a poll we're going to start with just kind of get a baseline of where people are at, kind of, do you know already what I'm talking about when I say that? Is that kind of a new concept? Is that things you've already done things on? So if you could do that poll, launch that poll, and we'll get a sense of where everybody is in the room. So David, whenever if you're able to do that poll,
Hmm.
there it is. Well, that looks like I'm seeing results of a poll that it looks like people didn't take. I never saw. Oh, there we go. Excellent. Sorry, it's my first time being on this side of a poll where I don't get to see the answers. Looks like we have 9 people responding. That's a good chunk of this. David, do you end the poll and then people can see it, or can people see what the results are here already?
Yeah, we can end the poll right here.
Sounds good.
Yes.
And share the results. So it looks like mostly people are, somewhat know about it. Some people not at all. So that's good. It's a good mix of stuff. We'll definitely kind of go into some of these things. So we can stop sharing that poll, and I will go on with this. I'm gonna close this. So what I think of mandated reporting to community supporting, it's not just a thing that's happening in California, by the way. It's a nationwide movement. And the idea is to try to reduce the trauma that's inflicted on children by amending the rules that govern when certain individuals are mandated to report any potential instance of child maltreatment, which in other words is mandated reporting. What about the mandated supporting initiative? Is that something people have heard of? Because often people get kind of confused with, MRCS to mandated supporting. What mandated supporting initiative specifically is an initiative of Los Angeles County government that is looking to do these things to transform LA's system, again, for some of these similar reasons. Another term, child welfare prevention services. So when we're talking about prevention, it's trying to, to help before there's an issue, to help as far upstream as possible, reduce family separations. Before is ideally there's even a need to call child protective services. Family First Prevention Services Act, FFPSA, is a federal bill that's pushing a lot of this. I say recent, it was actually 2018, so it's a while ago, but like states are trying to get online to actually be able to have stuff in place where you can start pulling down some of this federal money in order to do prevention work. And community pathway, that term is kind of all the places where out in the community people can get help from places that they already know and trust. And instead of it having to be, kind of a centralized thing, it's like let's get people help out where they already are. Also want to make sure when we're talking about abuse versus neglect, that we have the different types of abuse: sexual, physical, emotional, exploitation. We have severe neglect, where it's so much to the point where there's severe malnutrition, medically diagnosed, not able to thrive. So that's like the extreme amount, or intentional, if you're intentionally trying to keep things from children. Whereas general neglect, this term is more just the failure to provide food, clothing, shelter, medical care, supervision, where there isn't actually any physical injury, but there just is a need for something. And a lot of times this idea of general neglect gets mixed up with, kind of poverty. You're thinking of not having the food, the clothes, not being able to get the medical, appointments that you need, or get to those medical appointments. A lot of those things often interplay with poverty. I'll point out this last piece of it, but the child is at substantial risk of suffering severe harm or illness. That part of this definition of general neglect is recent. It was actually added a few years ago in AB 2085. And it kind of puts a filter on it. So it's not just that there's a lack of, shelter, but there's a lack of shelter and the child is at substantial risk of suffering harm. A lot of times people don't really think of that. I don't know how many people even know that like extra thing was added to it. That's one of the things that we are kind of pushing with, trying to make sure people know that like that's an additional aspect to it. And then there's harms of over-reporting. And be clear what we're talking about, not as of reporting. Reporting is one thing. If you think that there is abuse, if you think that there is any sexual abuse, if you think that there's severe neglect, if you think there's even general neglect where there's a substantial risk that that child is going to get harmed, that's not over-reporting. That's just reporting. But we're talking about over-reporting, doing it in times where it's just like, I don't know, let me just report it. Let me just put it in there. I just think I'm just supposed to do it, or who knows, let somebody else figure it out. Let's report it. That's kind of the over-reporting. I'm gonna stop sharing for a second and just see. I kind of like to have a little audience participation and see, can anybody, does anybody think of things that might be the harms of over-reporting? Like what's the problem? Like, oh wait, so we report people that don't need to be, instead of getting them some help, let's just report them to the system. What could be a problem with that? Does anybody, want to raise your hand or just kind of come off mute and say or put it in chat things you can think of that might be a harm of over-reporting? I know you're here to hear about this from me, but is there anything that you all see, you all hear, feel that might be an issue?
I would think the trauma it inflicts on families of over-reporting on cultural differences, what one culture does, and it's just being over-reported. Oh, they didn't comb their hair right. They didn't comb their hair right. These kids are being neglected. I've heard that a lot. It's like, no, that's their culture. They do the locks.
Right. So definitely the trauma that you go through.
Yeah.
And if that's happening, if you know that if you go kind of ask for help and there's a chance somebody might report you on that stuff, that might it might make you kind of less interested in going in and seeking the help that you need. Oh, Keith, go ahead. I see your hand up.
Just to add what Dorel said, it's trauma period to take a kid from their home, especially for something like, I don't think there's a clear distinction between neglect and being poor.
Yeah.
So sometimes, kids go to school tired, they're hungry, they might be sleeping in a car, they might be dirty. Maybe the parents don't have money to wash their clothes at that point in time. And like you said, over-reporting, most people don't have a conversation with the parent. They're just gonna, because you can go to jail and you can get a fine for mandated. If you don't mandate reporting something's wrong, I think that's one of the reasons people over-report. But that's traumatizing to not only the child but the family as well, especially as Darrell said for minorities, because the relationship with police has not been historically that great. So just stripping it, that can have lasting, even if it's not substantiated, just to come into the house with the police and things like that is traumatic for the whole family.
Definitely. Thank you, Keith. Exactly. I appreciate that input. Denise.
I just wanted to kind of piggyback off of what they both said because economic insecurity can make it to where, you might only be able to afford to feed your child one meal a day because you're just barely paying the rent, and
Right.
like, you may not have a washing machine at home. So you've got to get to the laundromat. You've got to have money to put in the laundromat, just like a young lady at a meeting last night that I was in yesterday afternoon. She had to go do laundry, and that was going to be like $20, and that's a lot of money out of a person's budget if they're on a very limited income.
Right.
And I think that it's more important, that if you see an issue and it's something like that, figure out how you can help that person, and go that direction as opposed to thinking that it's a problem instead of what are you all doing to your kids?
Yeah.
Maybe, is there something we can assist you with? Is there something that you're struggling with that perhaps we can help with? And go into it with a helping mode instead of, well, you're not taking care of your kids the way we think you should. They just may not be able to, and that's important to remember.
Excellent. So sounds like the room definitely, you're exactly right, Denise. That's the type of stuff we're talking about. Sounds like the room is kind of, in that headspace. So let me continue with my presentation here. So the things that we had kind of, as we're going through this stuff, thought of were trauma and stigma, that is inflicted, the trauma if you actually get entered into the child welfare system where it wasn't necessary, but even just the investigation itself can cause trauma, even if it's investigated and ends up, no, we don't need to separate you. That induces trauma. Overburdening the system, again, if there's if we're focusing, if there's so many things coming in that are not what the system needs to deal with, it makes it so the system can't focus on those times where sometimes you do need to. Sometimes there is abuse and you do need to separate that child from that family. We're not saying that the child welfare system should go away. We're trying to refine it and make sure it can be used for the times where you actually really need it. Parents then become afraid to ask for help. So if you're worried that if you kind of go to some place and say, I need some food or I need this or whatever, they may be like, wait a minute, now I have to report you. That doesn't help. And so parents will often just kind of shy away from getting help that they might need to get, which would then help their child. And a disproportionate representation. There are certain racial and ethnic communities that are part of the child welfare system to a much higher degree than they are of the general population. So that's disproportionality. So that was kind of setting the stage. Part two, I'm going to go through some data that kind of talks about this stuff. It's one thing to have these feelings about it and to think to have hunches and, lived experience, but to actually go through the data is always something we want to root this in. And I want to acknowledge that these next few slides that I'm going through are slides that I'm lifting from a mandated reporting to community supporting task force presentation. And by the way, let me see the chat. Is there anything new? All right, nothing. I'm just asking people to sign in, and please do sign in. So, general neglect is the number one allegation that we see. It's 45% of all the allegations are related to general neglect. And it's that so much is sometimes such a catch-all. Like if we don't really know and you're not really sure, again, there's the actual definition of neglect, especially the new definition now that's 2085 passed. But do people really know that? Is that how it's actually used? It's often just so many things. Well, something is not quite right, or let's have it be looked into. It's often general neglect. In 2023, only 1 in 9 children with an allegation of abuse were actually substantiated in California. I'm going to go through the next kind of slide here, shows how that breaks down by different professions and types. I'm wondering, does anybody know what they think kind of the biggest category of reporters is? If it's something that if you already kind of know, like, oh, this is the profession, or this is where people usually report, and they often get it right, or they often don't get it right. Anything that you kind of think about that. If you have an answer, feel free to just come off mute and say it. But I'm about to hit this next thing here. We have education. Definitely by far is the blue bar is how many allegations, children with one more allegations. And then the orange bar is the percent that's substantiated. So overall, it's about 11%. But when you look at certain categories like education, counseling therapists, it definitely decreases to 4 and 5%. Whereas if you're looking at like law enforcement and medical, it's much higher. It's 23%, 16%. So there's different professions and types that kind of have different amounts of like how much they're reporting when there actually is something going on versus how much they're just reporting. And the next thing I want to look at kind of we talked about the disproportionality, the kind of the difference between the kind of percentage. This next thing is going to show, especially with Black and Native American children, are much more likely to be involved in the welfare system. So here you see kind of the question is, how much more likely are they to be involved than white children in the system? And you see we have allegations. It's all the way through kind of the flow of getting involved. So it's allegations, investigations, entries, and finally in care. You'll see it even increases as you go. So it's 3 times more with allegations. By the time you get to how much they're in care, it's almost 5 times more. And these are the racial disproportionalities that we're talking about that are one of the things we're trying to reverse these trends. And as another statistic looking at that, 1 in 3 children in the US is subject to an investigation by the time they turn 18. So at some point in their life up to 18, 1 in 3 children in California. But if you're Black or Native American, it's 1 in 2. And that's definitely a difference. And so that kind of takes into account, the percentages of what the population is. And so that's the trends that we're talking about. So then the next thing is kind of the potential solutions. State of California put together a task force that's called the Mandated Reporting to Community Supporting Task Force to kind of figure out, well, let's figure out what are the different things that we could do. This is where I was part of this. So just a brief of the timeline is that in March 2023, Child Welfare Council kind of creates this task force, says, come back to us with some recommendations on what we could do. There was an application process. It was, 250 different people submitted. You had to say what your background was and why you think you'd be helpful to this committee and task force and stuff. And of those 250 submissions, there were 32 people chosen to be actual task force members, plus an additional 78 who served on subcommittees, and I was one of those 78. And came together, and between November when we kind of kickstarted and May when the recommendations were finalized, came up with here are the different things that we think would help. Broke up into the subcommittees because there's a lot of different ways to look at it. It's like one thing is that legal definition of neglect. Another thing is looking at, well, how are people getting trained? Do they know these things? One thing is the research and the data. So that stuff I just went through. It's like, what does the data actually tell us? What should we be looking at? So there's all these different kind of angles and things to look at. But at the whole time, through the time, there was a North Star that we kept in mind, which was keeping children and families together, safe, well, and strengthened by the resources they need to thrive. That was kind of what we were really aiming towards. I would definitely say that the subcommittees were, had a wide range of people who were in them. You had some people from the government systems, but from all different departments. You had parents and youth with lived experience who had actually kind of gone through as parents the child welfare system. You had the Child Welfare System Directors Association on there. You had community organizations that focused on mental health, substance use. There's a lot of different things. And so certainly I can tell you that what the county welfare directors thought about how to handle things was different than how the lawyers and ACLU thought about how to handle things. And the question was, can we come together to find things that we agree on, things that were that we can kind of support as a community, kind of that if there was some kind of change, we could all say, yes, okay, because of the conversations I've learned, and I, realized that, yes, this is a kind of good middle ground to get where we think we need to go. And that's what the idea of the task force was. But I will ask a question, do you see anything that is missing? Take a look at these different categories, and, ask, do you see any kind of group of mandated reporter or somebody else who would have an opinion on this that isn't reflected in this? I'm going to stop sharing for a second again and ask if people, can reach out and say, is there anything that any category managed reporter that you think wasn't on that list? Can you think of who you often work with? I'll give it a second and see if anybody has ideas. And I can even think about the slide I did a few slides ago that kind of showed the different, how big of a, how many reports come in from this category versus other categories. Remember, we saw education was the biggest one. Although there were a couple of nonprofits that work in the education field, there weren't frontline teachers on this task force. Law enforcement we work with, fire paramedics, things like that. That wasn't on there. We did have some people who were medical on there. We had some therapists, but there were certainly a lot of places where still, as we put together these recommendations, we go with them. There are people who have kind of more thoughts on that, who really have to deal with this and work with kind of the mandated reporting system all the time. And that's something that, kind of we're definitely working to incorporate those views and kind of to get, okay, we've got to this place, but what else is there? What else can we learn? That's something that we definitely I'm saying we as in like the group of people who are kind of pushing this initiative are definitely over the last few months been working with and kind of increasing even more input. I'm going to go back to my slide and say, okay, what kind of recommendations did we come up with? I'm going to go back and continue with that. So here were kind of the recommendations. There, this is as paraphrased by me. There was actually a kind of a formal report, which is linked in this, that had very wordy and had things together, but to kind of make it easier to kind of just go through, I've paraphrased what they were. So there's a number of them that were around adjusting the laws regarding mandated reporting. So certainly an idea of removing general neglect as a category that's mandated to report. So making it so people are mandated to report all the other things, but if it's general neglect, if it's just somebody who needs some food, who needs better supervision of children, so therefore more childcare, maybe that shouldn't be mandated to report. Clarifying severe neglect to make sure that it actually covers stuff it should. An idea of shielding mandated reporters from liability. And we want to make sure we give them maybe improved training and decision-making tools so they know, what should or shouldn't be reported. But the idea being, I think Keith touched on this, that if your mindset is, I need a report because I could lose my license. Like, I don't know, I don't really think that there's, abuse going on here, but I just need a report because you always have to report. Would you rather that be what's going through the person's head, or somebody actually thinking, is this child in danger? If the child's in danger, if I think the child's in danger, I'm definitely going to report. Like, we want that. But if the child's not in danger, if it's not actually abuse, it's not getting to that point where we need to kind of maybe separate them, but we need to get the child help, that's kind of what we want going on in the mind, instead of like, I just have to do it because I'll lose my license. Let's try shielding and see how that works. And also let's study whether it helps to have such a wide range of professions be mandated reporters. Improving training. By the way, actually making sure that there is training right now. There's no requirement that all the people who are mandated reporters need to be trained. Certain professions have it, but it's not. There's many mandated reporters who are just, it's required to give them like access to the code, the penal code. Like, here's the penal code of where this works, and just know that you're responsible for it. And that's like the training. There's no training they get. And also make sure, so let's make sure everybody gets some training, but let's also make sure that that training includes things like implicit bias and structural racism, kind of understand that, the possible stuff we talked at the beginning, the possible harms of over-reporting, and making a web page that kind of lists that so it's easily accessible. Enhancing the community pathway. We definitely know that we can't just be pulling back from reporting and just hoping, okay, well, and everything's better. We also have to make sure that this community pathway, that the services and supports are actually there to help people. And one point of that might be, let's kind of maybe do like a capacity, assess the capacity of what we're actually at right now. And then also make sure that as counties are creating their prevention plans, and this goes back to that federal law I talked about, FFPSA, where counties can draw down money from the feds once we kind of get that set up. In order to do that, each county has to have their own prevention plan. And what we're saying as a recommendation is, let's make sure in that prevention plan that the community pathway is part of it. So it's not, so that like that's kind of something that people are aware of, and knowing that here's where you can get help in your community. And then let's also kind of implement and make sure we're kind of continuing to do this, all this data that we looked at, this Shaw, like what were the disparities, and this work. Let's make sure that we're kind of keeping that moving forward. And those were the recommendations. And as far as where we're actually at with trying to move those forward, I'll say that first idea of removing general neglect has 2 different times been a proposed bill that was carried, but failed. It didn't make it through. So that is something that has been tried to get passed and didn't get passed 2 different times. This whole idea of shielding mandated reporters from liability and giving them more training and a decision-making tool, but shielding them from the liability so that their thought process is different. That is something that is currently being considered as AB 970 in the legislature right now. And then all these things that are highlighted in gray are kind of wrapped into a different bill, which is AB 601, that is also being considered. So neither of those things are currently law, but right now the legislature is considering whether or not to do those. And so that was the whole idea, was like, let's do this task force. Let's come up with recommendations that a wide range of people can get behind. And then, okay, now let's try to get these, laws changed. And so that's where we're kind of at right now. And I just wanted to kind of bring us back to what we're talking about with the guiding principles. The reason, again, that All for Kids is in this work is because what we want to do, and kind of what we're always pushing for as a voice in this, is making sure we're finding ways to streamline referrals for those families who are in need, instead of kind of going off to other places. And like with, if we can just get the help, get that person connected with where they can get the help, like that would be quicker and faster and less traumatic. Relieving the system, so there's not things that are in the system that like don't need to be. So that way we can really focus on those things that do need to be handled by the child welfare system. Incentivizing prevention by reducing the fear of asking for help, and then reversing trends that destabilize families of color. And here are the things, kind of, again, the recommendations. One note I'll say, this idea of removing the mandate to report general neglect. One thing that wasn't a recommendation from the task force, but is really kind of out there, and probably one of the things I'm really in favor of, is instead of removing the mandate, maybe changing what that mandate is. So if it's general neglect, you're still required to do something, but what you're required to do is to report it, to connect it with a community-based organization that can help. Or perhaps this county should set up kind of a almost like DPSS, Department of Social Services line, where it's not looking towards the child welfare system, but it's like, let's just get them help. And the same way you have to be able to prove that you did report, well, you have to be able to prove that you did at least do this thing to connect the family to help. So I'm going to take this down and ask the question again. I saw Keith, you had your hand up. I'm happy to have you give input if there was something you wanted to say there. Was there something that you had on your mind?
I was just agreeing with you. I'll give you a thumbs up. But I do have a question though. Why the populations that you mentioned, like the teachers, firemen, and things like that, why weren't they included in the task force? Was that a volunteer thing, or by invitation only, or what?
Yeah, so it was. Remember the beginning we're talking about, there was an application process. We kind of tried, and again, first of all, I wasn't in the kind of steering committee that led the thing, that put together it. I was just one of the members of the subcommittee, so I can't speak for like, why they necessarily took actions or what they did. But I know that there certainly was a application process and people had to apply. And so there were 250 applications that came in, and from those 250 is how they selected the members of the task force and subcommittees. And I know that they did try to, kind of spread it as far and wide as they could. They went to kind of Department of Justice and went to some, areas like that to make sure people were in it. I don't know. I don't believe that there were anybody kind of from those professions that applied. I can't say for sure. Again, I didn't look at all those 250, but I think that was one of the things. Yeah, so I think that was probably the reason. Also, it might have been, we were looking at there's so many kind of different pieces of the child welfare system and the organizations that make it up, and kind of such a wide range of views already, that it might have been like, we have to at least make sure that through this group, kind of this wide spectrum, we know where we're at. And then it's a matter of, okay, taking that and talking to the next groups kind of after that. So that might have been it. Again, I'm speculating. I can't say.
No, I appreciate that. I'm just curious because they're the most frequent reporters, and to me, the first line that sees kids in situations, or what their job is not to investigate but to report. It seemed like it would have been more effective to have them in there. I know it's not your fault, and I'm not saying that. I'm just saying, now that we use people's voice to provide services, I think that was a very good move, because nobody knows what they need more than the people themselves. And to have a committee that's not involving the people that's doing the most reporting, that I think. But you said they're going to expand it, so that's different. So I thank you for that answer.
Yeah. And I definitely know I know that, for example, I'm involved with ICANN, which is kind of it's a group that brings together all the different departments of LA County government, along with agencies like the sheriff and the district attorney, things like that. And I know that that's something that they certainly are involved with making their voice known, making their thoughts known about this. And I know it's something that, at least from the LA County portion, that I know that Dr. Tamara Hunter is very eager and wanting to work with them and kind of make sure that that dialogue is going. So I know that I can speak for in LA just because I know I've helped kind of facilitate some of those conversations. I know that that those conversations are ongoing and they are looking to get that input. So I know that that is something that's happening. I actually facilitated bringing the people from the kind of the steering committee of the mandated reporting community supporting task force to come and present at ICANN for that same reason, to kind of make sure that that dialogue is going. So of these things, I guess the question is, can we kind of see how some of these recommendations would fit right into that? And that's what I'm hoping you can walk away with, is kind of seeing where those connections are and kind of how we can move forward those guiding principles through those connections. That's kind of the main part of my presentation. I'm definitely open if there are any questions or things that I didn't cover or things you want me to help clarify. I'm here and happy to do that. Well, Darrell, that is the presentation I had, and I'm
All
here.
right. Thank you, Adam. That was some great information. And I know we've learned some additional things that some of us didn't know. I had been familiar with the transition and change of phrasing and what the county is looking for. But thank you for sharing additional information. If anyone has any more comments or questions, or just want to say thank you to Adam for sharing that great information, feel free to do so or drop a comment in the chat box. If not, next slide, please. So we want to again say thank you to Adam and encourage you, if you are not already currently following us, Best Start, you can follow us at allforkids.org. We have our link tree where you can see where we are offering other seminars, trainings, groups, and be a part of our community of initiatives that we are working on. You can follow us on Facebook, Instagram, YouTube, and be a part of this growing movement with Best Start. That is it. Thank you for joining us. You can take our survey. Just scan our QR code. Let us know what you think. This is our general survey. We would appreciate your feedback and anything else you would like to add or suggest, any other informational trainings or seminars you would like to see from Best Start. With that, I want to say again, thank you, and we're going to give you back the rest of your morning. Have a great day, everyone.
Thanks, everybody.
Thank you for coming. Thank you so much again, Adam. That was really good.
Yep, definitely.
Before you leave, sorry, I do have a question. Would your PowerPoint be available to share out?
Oh, yeah.
Yeah, I will send it off to Best Start, and I'm happy for them to share it.
Sounds good. Thank
Okay.
you.
Helen had a question. I see Helen, your hand is up.
Yeah, can you hear me?
We can hear you.
Yep.
Okay, great. I'm trying to fill out your QR survey form and I don't see this particular event there. I know how important it is for us to collect data, so I just wanted to bring it to your attention.
Okay, maybe just fill out a general one. I know David, is David still online? David?
Or should I just use the trauma-informed violent child raising training? Sounds like that's a
Yeah,
completely
sure.
different one. Want me to do
Yeah.
that one? Okay.
And then we'll fix it in post
All right,
for the
great.
right one. Thank you, Ellen.
You're welcome.
Thank you so much.
Have a good one. Bye.
Have a great day, Helen.
Thanks. Bye.